Today, I am Dr. Wilfredo S. Tagle, urologist, and welcome to Medical PracTIPS, a series of tips and tricks to help you start your medical practice. Today's episode will be about how to market your practice to your patients and to your peers. There are three pillars for a successful medical practice. Number one is reputation. You have to be a good person, a good doctor, and a very good reputation. You have to stand out from the community you are living with. Number two, availability. Make sure that whenever patients need you, whenever peers need you, you are there, they know where to find you, and you are always available. And number three is feedback. Be sure to protect your reputation and your name. So patients would give good feedback, not only your patients, but also your peers. So they will give you feedback. Nowadays, patients and peers always look to good, favorable feedbacks. Okay, then, in order to have a successful practice, you need to stand out. As I said, you have to be one, but not among the rest. Always be different or always stand out from the group. Make sure that you're not among the rest. Number two, you also need to make sure that you are available for your patients and peers. Whenever they need you, you are there. Make a single number, phone call number, address, and schedule. So they would know where to find you and when to find you. Don't keep on changing your address, phone numbers, and emails. Allot of time for them by setting office hours and sharing your contact information to your patient. If possible, you get a contact number for patients or for public, and you maintain also a personal contact number for your family. And attend events or having meals or social activities with your patients and your peers. Okay. Next, you must also show both your patients and your peers that you are reliable. Whenever they refer to you, those patients that comes from your peers and your patients would give positive feedback to them. That means you are a reliable doctor. That means hindi ka papalpak and you will give the necessary or the expected results that they are looking for. That's why they came to you and the patients was referred to you by your friends. Next, you have to be frequently available. Even if you are reliable, you are available, but your schedule is once a month, it is not good. Be frequent with your schedule. As much as possible, go to one clinic that you are available every day. Or, if possible, the whole day. Just be available and they will go to you. Next, show your practice is affordable. If you are practicing in a certain locality, just be reasonable. It should be affordable to the class of patients that you are serving. Don't stand out with your price range. Always consider the financial capability of your patient. Of course, on the other hand, you have to have price or value to your services and your specialty. Next, you need to know that the appropriate price range for your practice given your skills, specialty, experience, and of course, knowing the demographic area which you are serving. Ibabalanse mo lang. And of course, you offer your services to your peers and patients. Maybe you have friends from high school, friends from college. They don't know what is your practice. They don't know that you are a doctor. They don't know what is your specialty. And maybe they don't know what are the possible treatment options that are available and you are offering to your patients. Just give them idea on the services that you can offer to patients. Another important thing is you show empathy to your patients, to your peers, and to your friends. You have to be with them. You have to feel good if they are feeling good. You have to feel bad and sorry with them when they are at sorrow. You have to show them that you care. Importante yun. Next, you have to have a specific practice. Let them know that you are in this kind of field. Number one, if you are a surgeon, you let them know that you are a surgeon, a doctor that makes operation. Don't try to be a general practitioner if you are a specialist. Don't treat dermatology if you are a surgeon. Then, among the surgeons, for me, I'm a urologist. 80% of my patients are in urology. Of course, as a doctor, you can still treat patients outside of your specialty. But as much as possible, don't advertise to other patients that you are taking care of other services. Let them know that you are on your specific specialty so other doctors, your peers, would also refer to you on that specialty. Have a specific target patients and peers. Next, your practice should be measurable. You have to know your census. You have to jot down, record your services. All your efforts should be measurable so you can compare it with your past services and census. So you would know what to improve and what to revise on what you are doing in your medical practice. And lastly, feedback. Always ask feedback from your peers and from your patients, whether it is good or positive, or on the other side, negative. What did they like best on your services, on your personality, on your treatment? Ask for positive feedback as much as possible, and if they can give you some referrals. Lastly, always thank them for their referrals. Okay? That's it for today's episode. Like, follow, and subscribe to our Facebook page and YouTube page to catch the latest episode of Medical PracTIPS, every Wednesday, 7 p.m. Please share these episodes of Medical PracTIPS so we can help more young doctors, aspiring doctors, build their practice and better serve their patients. Okay? See you. Bye-bye.